Good evening. Just to give you a context, a couple of things. I think at least 2 or 3 speakers spoke about Hyderabad, right? So we were just talking to a few doctors in the morning. The one of them is, city of pearls, as you know, and the next one is city of pills. Pearls and pills is our new theme now. So we always say this. At the same time, it's a small world. I follow Rajiv at least very closely, and what is he doing? Very shrewd, as well as not a single quarter goes away without Dr. Satya's numbers in our management review meeting. He's always, very quiet in getting this done. At the same time, in every management review meeting, it comes up, how is it possible that 30% EBITDA, you guys are struggling every day. He is 20, 30%, non-stop is doing it. So that's an amazing. For us, both in terms of topic, there was only, nothing much was left. I was the last guy. So, and doctors spoke about, the complex biologics, and Rajiv spoke about complex. So I was left with small molecules. I'm also happy that the small molecules, because we are the small molecule company. And it's very, at the same time, I think we also, I think we got at least in terms of Dr. MSN, I think GVP sir is not here, but Dr. MSN himself was, a Reddy's product, He was the only company he worked was Dr. Reddy's, just like you, sir. And at the same time, half of my management team is, ex-Reddy's, is very proud of them. When we speak about culture, we speak about Dr. Reddy's. At the same time, Mohanty sir is not there, but I think that we already have QR code. He was talking about QR code, and India is a master of track and trace, how things are, and we have mastered the whole thing. I just want to share with him. But for us, in terms of chemistry was like, was our nature, in terms of, because doctor being, chemist by himself, we have done, good job there, particularly small molecules. Now we've also ventured into, I want to give you a context about, on what I'm talking on it. I'll just share with you of our thoughts what we're doing. Just to give you a context, I also want to share with you, as Rajiv mentioned, for us also, it's very, we learned a leaf or two there. We noticed that brand companies, they never come to India. So, because of the value, I think the value is very small, and they're worried about IP or how the generics will come out. So with the very first molecule, I remember 2008, we did like Bosentan, nowhere to sell. It's very tough to, it's a PAH indication, and it was not even there, not even a diagnosis there. And we partnered, with Lupin, and we learned our ways. Since then, almost 20-25 products we have developed first in India. Do a phase 3 study, bring it to India. That's what we have done. And and just to share in terms of costing too, let me just share with you. Just to share in terms of costing also, after the patents are broken, and then when we entered the market, so the whole therapy of diabetology, now it's come down. So it's a wonderful thing, and then we're very proud of it because we were the first company to introduce many molecules in that segment. So just to give you a context on what makes us at least a reasonable expert in small molecules, is because we're one of the fastest growing companies here, almost about 550 APIs, mostly small molecules. We also have a peptide program here, and we're also started biologics program, but small molecules is our strength. And we have 25 facilities. Thanks to DCGSR also, imagine 25 facilities, 100 products in a pipeline. Every year, how many test licenses have to apply? So now that you remove test license requirement, it's like it was a big thing, for us, again, GMP is important, GLP is important, regulator is important. My guys are more worried, than FDA, of local drug regulators, Without a test license, they will not do anything, not even testing. And on top of it, we have an R&D center. And it is like combination is like, permutation is like 2x now. Every product gets developed in R&D, goes to a plant. Now I have to make sure that I have a license in plant and R&D, and make sure that is live and viable, So, and that's, and even before you do small tests. So that's, thank you very much there. And at the same time, I think there are 4 or 5 things that probably sometime I'll share with you on how we're shooting ourselves, in India, which is not there in other world, in Europe or America. I don't see them every day. That's something. And today we're a young company, fastest growing MSA, and 23 years in business now, 100 plus countries, almost about 400 formulations we have. And we are number 1 in US DMFs, and still leading. And we have 25 facilities. Again, on the formulation side also, I mean, capacity side, I think we have covered 50+ billion in terms of oral solids. And most of our products, we are also very strong in chemistry IP. So almost about 50% of our, we have about 270 or 270 ANDAs filed, but close to half of them are first to file. And we have, getting a little bit of success now in terms of, finding from molecule with fewer players and less competition, but that's 50% of molecules are first to launch. And not only for US, first to launch in India, right? I think we are always working on, hey, where is the patent situation in India? How I can, circumvent this, or how I can bring it first in India. And you won't believe, just like India, if you, emerging markets, I think we are also very, very thankful that we had the opportunity to work in emerging markets. You go to Africa or Asia or Latin American countries, and all of them are behind India by 10 years, I must say, sir. And we were the first company to introduce pregabalin. Lyrica works like magic, in neuropathic pain. We were the first company to introduce it in 2011 in East Africa. Right? Every country we go, we're getting all this goodwill, right? I see that, it's because we're introducing all the new molecules, which was actually done for India. Replicating what's been done in India, in Africa, or in French West Africa, or Asia also, Cambodia, Myanmar. So, I mean, really, it's excellent, I must say, and it's a blessing in disguise for us. So I'll just cover a little bit on the sustainability side when I talk about, and we also have like the certification just to share with you on the EMS side as well as the ISO. So small molecules are dal and roti today. So that is what we have in our hand today. If you look at it, almost about $460 billion of small molecules today in terms of generic market space. 98% of the doses, 91% by value are small molecules. Right? We cannot let this go. This is the survival, right, today, and that's what we're working on, and we're very proud of it. But in terms of, the reason is, you look at it, biosimilars, I know it's future, we are also working on it, but end of the day, the acceptance, the penetration is very, very, is challenging, tough to understand, I think how it's going to unfold. But hopefully, I was telling to doctor also the other day about the, how the world is evolving. I mean, biosimilar side, hopefully the phase 3 thing is knocked off, and phase 1 is knocked off, then the game is different, right? People who entered 10 years ago spend more money than what we would spend here. It is like getting into using cell phone, forget the landline, right? That kind of behavior, I mean, in terms of biosimilars. So we are very happy that it's happening, but I think we are, it's nobody, either India or anywhere else, you look at it in terms of adoption or in terms of value, in terms of availability, it's still, nascent. And for us, small molecules are key today, and then almost 1 to 3 years development. We have a pipeline of 100 products every year, and spend about 1 to 5 million on each product. So I'm not a chemist, but I'm a sales guy. But at the same time, I got this. Some of the things we're working on the API side sustainability. Now we have a world-class continuous manufacturing flow chemistry line. So to understand, assess. Because of the assess how the reactions work and what can be done for us to, in terms of scale, safety, and process efficiency. So we kind of simulate, this is what we have, and that's something is very, I must say, all API plants, APIs, must invest in, right? We were recently in CPH China, amazing in terms of flow chemistry, how these guys are working on. If we don't get right on this bus, it's going to be it's going to be a tough game for us. And of course, it's always about being sustainable. The biggest threat for us today in APIs is China. So we are trying to be cutthroat in terms of how to save, And one is energy. Of course, we are constantly working on our audits and how to see, how to minimize losses, how to minimize in terms of solvents also recoveries. Right now it is GMP process in solvent recovery. We have multiple systems to work on this one. And we're trying to master this also. And the last, now, so previously it was all chemist game. Now it's process engineering game. We have process engineers now who are working on how to make atom economy. Right? Look at the molecule and what is it. It's not about the yield or cost saving. It is about how to make sure that what I start with majority of it ends up in the finished product. So that's the efficiency of atom efficiency is what we're working on very closely. And we hire process engineers now to work on this one. And of course, we don't let any water out. It's all used for either boilers, cooling towers. 100% water is utilized. We almost have 1,000 KLD, probably one of the largest in this part of the world, on the ZLD operations. And the newest one has been the last 4 or 5 years we're working on is enzymatic reactions, right? Everywhere trying to see is there an opportunity for enzymatic reactions, right? So try to, as you know, these enzymatic reactions can simplify a lot of things, right? You can generate a pure isomer, I think the product, the desirable isomer. So we're working on all this in terms of to be sustainable, right? I'm talking about in terms of sustainable, and also replacing all this high-end palladium, nickel catalysts with, simple modified iron versions, right? And last but not least is the solvent usage, right? Avoid volatile, I think like MDC or CDM, you call it, replace with some simple class 3 solvents. That is what, in the chemistry side, we are always looking at it and see what is possible. On the finished product side, again, we are constantly, because, I think just to start with, when we do products, so when you do a first to file, you're always trying to mimic, like maybe make a copy of a generic, just like, look and feel, everything same. But as molecules mature, we are working on, how do you make it smaller? How do we reduce the excipients? At least about half a dozen products today we're working on how to make it smaller, how to make it, I think, more efficient. And where possible, direct compression to obviously to make sure that it's to avoid to get the advantage of I think reduce thermal energy and use of everything, no drying, all this stuff. And last, we're not using yet, but the packing material side too. Hopefully, I think in sustainability this is very important. So we are evaluating single materials like it's like a PP pack which you can see through, and there is no aluminum layer. So we're working on that kind of material just to make sure that, all this is tied up to, the carbon emissions and then our ranking there and how to get there. We are doing a conscious effort in that space. And bulk packs, where possible, we're trying to push it. I was very surprised. Even in America, it's very common, but even in Europe also, now it's getting, on the older molecules, bulk packs. So we're doing that also and of course, solvent-free processes. And few other things are like, I think one is about the e-pill, pill is one of the patient information leaflets, I think they are the least used. And, when you have, I'm telling you, so much is waste there. We're talking about in a month, if I pack like, let's say 2 million bottles, I am really sticking 2 million pills for America. That is a real disaster, and we have been trying to reach to every regulatory body. And thanks to India, I think now we are using QR code and all the pills. But at least other countries, we're trying to explain to them. Nobody reads them. Everybody has a smartphone, right? No point of putting a pill in there. Fold the damn thing on 100 times, and then spend money on it. And that is something I hope I think we could take it up with other regulatory bodies and see what can be done to avoid this. And that is one thing. And we. Of course, we're trying, and the other one is global product, right? Just the way. No, we are very, very absolutely, we have a concept of global product. So same product goes to India or Sri Lanka or Africa or America. So that has brought in a lot of value, as Rajiv mentioned too, for us, because when I develop the molecule, like, I'm making sure that it suits America, look and feel Canada. Of course, it's very complex if you want to do it for all markets at one go. But end of the day, think of this. You look at China today, right? Whatever it is, they want, if it is less than 2 ml or 2 ml injection, 50-liter batch size. They don't allow, even if it's orphan, or they don't allow less than 100,000 batch size. I need to make sure that all the Chinese excipients are China compliant. So we do all this global product. Even though I don't do all this on day one, I keep in mind my dissolution side. Am I doing multimedia for Europe? Can I pass a fasting and fed bio study? Can I match my, US? So kind of trying to do this one, that is kind of reaping a lot of benefits. That's the reason our products, now we register the same products, almost about, we have 2,000 dossiers in emerging markets, almost about 200 plus in America and another, 600, 700 in Europe also. So that is possible only because we are able to do this one. So that is what reducing the cost of development too for us. And of course, then the other one is packing harmonizations. And packing side, we are trying to see bilingual packs, right, where possible. Some of the Eastern European belts, some of the European belts, some of the French Africa ones, French and English, right? We're trying to see print all of them in one. And we also have one, I don't know the printer name, but we have a printer in-house, for example, every time I go to printing, when I have so many SKUs, I don't know whether, it's very tough to handle emerging market because they all need, like, imagine each of those countries like a state, right? So we want a small batch. So we have like toy setups in GMP, like, which is like 1/10 of manufacturing also. Then we come to here, the only thing printer takes is the minimum of 6 kgs of foil. I use 1 kg and 5 kg sits there for next 6 months. I do not even know. So we have now an in-house printer, right? I can print 1 kg also. So I'm not wasting anything. So that is the efficiency we're trying to bring. And last but not least is about, filing to launch. We monitor very closely when are we filing, when are we launching, right? Don't miss a day one, any country, So that's a focus there, and that's the only way. I think in generics, particularly in small molecules, competition is so huge. Unless you are day one, the honeymoon is only in the first few months or few weeks or until somebody else comes in. So that is where you make your money, or you do whatever it is, or get the mileage also in terms of, could be a doctor's chamber or could be a country. So that's where it is, and we try to explore there. So here we don't do most of this, but I just put it here. The elephant in the room is, as I said, is AI, right? How do we integrate AI? And we were recently, unless we do this, bring AI into our systems today, it won't work. Right, that is the reason we were exploring. In fact, I was just talking to Shekhar was here, from Caliber. I was saying, what are you doing? Caliber, we use Caliber. So just telling, what are you doing in terms of AI? Right? Are you, because we're talking to all our software vendors and hardware vendors. Explain to me, what are you doing on AI? Are you going to do, or should I learn? So all the enterprises, even our company also, we want to see how to bring AI, but I don't know. It is too huge, it's not like a small activity or, doing an analysis of a spreadsheet or come up with a business report, but how to use it. And we have started thinking this very seriously. Hopefully, we cannot sustain, if you don't do it. I was just telling my son the other day also, every morning, just think about that, can my job be replaced by AI? So then you are no longer relevant. You should think differently. And here on the APS side, we use, there are some software for, impurity prediction, and impurity mapping, all of them. But I think now we are talking to those software vendors also, asking them, what are you using for AI? Right, and also find how do I do a synthesize or come up with a route plan without actually experimenting too much, right? If you look at the QBD concept has been like, to paper to the lab, so probably half of that can be done with AI, right? To get the best shots out of in terms of what experiments I should do in every lab. So that is what we are working on. And of course, the virtual bioequivalence, already it's been in the industry, but we're talking about more of science only. Still there is more data to be generated, but we are talking about these 2 or 3 vendors on what we can do on bioequivalence, right? I generate some data and now start extrapolating on how we can be bioequivalent. That we're working on. And of course, reverse engineering, it's something, as a generic, that's the most important thing. And we're talking to vendors also on, how to identify visual inspections. I think like camera systems, they are all go with some kind of templates or samples. So we're trying to talk to them and then see how you could, what can be done as with AI, right? Can I predict a problem, or can I, in the line, a camera system can predict something, a missing tablet or a small crack. If I can identify, all my. And the last, the bottom part kind of, so we're already reviewing AI for document review or regulatory. Right, compilation dossier is like a menial task, right? It's not a big deal, It is a set process, and you compile it. So we are working on that, and documentation review and change management to see what is possible. But we really would like to see what can be done to explore there. So, and the next one is about supply chain, right? It's tough to have more than one source, I think, for everything. But I always call it, but it's like a KYC for your supplier, and very competitive in pricing, but I know how to do it, right? That is something on the KSM side, we are doing a very aggressive job there, and hopefully, and then market intel, of course, in generic space, it's all about knowing what's happening, who's doing what, or what they say. Unfortunately, it is very brutal. Success depends on somebody's failure. That's very brutal, but end of the day, that's a game, And we are now we very eagerly monitor, what's happening across the world in terms of APIs, in terms of FDA or EU concerns, in terms of and then try to, or we look at all the shortage websites, kind of monitoring, what's happening, including including what do you say, glass or vials. Trying to understand what's happening, just to keep an eye on what can we react fast enough. That's been our. And of course, KSMs, as I said, we are working. And one of the inherent strengths of MSN is because of our own APIs, KSMs to APIs to FDF. That is, it's a boon for us, backward integration. You see almost all the big companies, they don't want to do API anymore, but select APIs. If you look at Dr. Satya or Rajiv, so they do APIs, select APIs, of course, to match their requirements or for captive. But we certainly think that is a strength, right? That we can. Our chairman is very keen. We don't want to let that go. On the API strength, and it's very helping us a lot. And of course, de-risking. And we are also the last is that as we grow, the pains of growth are demand supply, mismatch of demand supplies, FTS issue, failure to supply issues, or penalties everywhere. So we are really now trying to digitize. Try to predict better, and then also manage how to, one of the KPIs for us is to how to reduce no penalties. Could be a Germany tender or could be an American this one. So these are the ones we're actually, all these activities we are doing to sustain the business, to be there, and then also conscious in our efforts. Last but not least, I think we are in the best shape, I must say. India side, I don't know, for some reason, Chinese miss the small molecules. So even though we see them as API in Europe today, but we don't see many Chinese filing for the US or Europe, right, on the finished product side, right? I see a lot of Chinese competition in the API side, but not to cherish that. But end of the day, for us the India advantage, almost 670 plus of facilities, a lot of European facilities here. The most important thing is compliance. For us, it's an excellent thing, because we are in all these emerging markets. Brazil, smallest of small country, even Nigeria want to come and audit you, or Kenya want to come and audit you. So it is like taking a test every day. Always say, as long as you are good in your either taking a test or you're compliant, it's excellent. So for us, EU, Japan, Europe, America, FDA, Korean, all of them, and then of course various customers. So because we are the API supplier also for many customers. So today, almost 50% business from API. So we are on a test every day. So that is the best part for us. That's how we always feel that helps us in compliance. It's a good thing for us, and we are very happy about that. And as I said, we are working on see what can be done in terms of rapid adoption of AI there. And then, market intelligence, innovative thinking. So, we want to have a clear message, at least for our Indian counterpart. We do not want to sell low. Don't compete with ourselves. We need not do it. The whole market is actually looking, but we are, unfortunately, to the lack of good word, we behave stupidly there, right, in terms of pricing. I have seen in tenders pulling our pants and shirts together. That is disaster. I think we should think sanely on what it is. Is it possible to do it, right, in terms of your costing side? Don't just participate to win. So we give this message as not an indication, but a saying that we will not do that. So just to make sure that we don't play the same game. And of course, I think we were also beneficiary of PLI scheme. I think it was wonderful. But however, as Dr. Satya said, I think we couldn't set up any facility. But at least on the export benefit, I think that was wonderful. It was a little shot on our arm, and it was nice. And these are all the ones which are actually, in terms of spotlight and help. Thank you very much. That's what, I think it's our context of how we're sustainable. Thanks again.
Thank you very much.